You see a doctor for fatigue, or maybe it was just an annual physical, and you discover your vitamin D, that is your 25 hydroxy vitamin D, is low. Now, it could be borderline low, it could be severely low, but most people get it wrong from there. You either don't do anything about it, or you get the right dose, but just for 3 or 4 months and then stop. Or you decide that all this while you were just getting inadequate or the wrong dose and your vitamin D level is still low. Hi, I'm Dr. Chhaya Makhija. I'm a triple board certified endocrinologist and lifestyle medicine specialist. And if you're new to this channel, go ahead and hit subscribe, as every week we talk about topics related to hormones, nutrition, lifestyle medicine, metabolic health, GLP-1, weight loss, and so many others from me as a true endocrinologist and not an internet rabbit hole. You can also tune into my podcast, which is Hormones and Hope, available for you to listen on Apple, Spotify, and of course, you can watch it on our channel on YouTube. So, vitamin D. Now, did you know that vitamin D is a hormone? And did you know that endocrinology is a study of hormones? That's the only specialty which studies every hormone. And the fellowship is called Diabetes, Endocrine, and Metabolism. And that's why metabolic health is also my specialty. Now, next fact, did you know that vitamin D is manufactured or synthesized just underneath your skin with the sun exposure? And then it makes into a product which then travels to the liver. That's where it's stored. And when the body needs it, it travels to the kidneys. And from in the kidneys, there is a conversion of inactive vitamin D to active vitamin D, that is called 25 hydroxy vitamin D, to 125 hydroxy vitamin D. And that's the active vitamin D in your body, the active vitamin D hormone, which brings about the effects in your cells, in your bone, in your muscle, and so on. But the vitamin D supplement that you're getting for treatment of vitamin D deficiency is not the active vitamin D. What you're getting is the storage form of vitamin D. So 25 hydroxy vitamin D is a test that you're getting to detect normal vitamin D levels or low vitamin D levels or even vitamin D toxicity. And the supplement that you take over the counter, which is vitamin D3, is also helping with that deficiency. So it's not the active vitamin D, which is 125 hydroxy D. We can cover that in another topic where that specific vitamin D, the active vitamin D, is a prescription and is used only in certain medical conditions. Okay, now here's the reality. 95% of us in almost the world, but now I'm going to focus on United States of America, are at some time point low in vitamin D or very often consistently low in vitamin D. So you're not alone. There are multiple reasons, which I'll cover in another topic or another video for you to dive into vitamin D. So while you're learning about facts that vitamin D is a hormone, how it's manufactured, now let us talk about the number that was on your lab test, what it actually means. So guidelines vary slightly depending on what is a insufficient level, what is a deficient level, and what is a sufficient level. But just to make things simple for you, 30 nanograms per milliliter, which is a common SI unit used in United States of America for 25 hydroxy vitamin D. So 30 and above, anything above that is pretty sufficient, and 30 and below is deficient. But if someone's less than 15 or even in single digits for the value of vitamin D or 25 hydroxy vitamin D, that's quite low, severely deficient, and you really need to treat that. Many times you may not have symptoms. Many times you may encounter fatigue or just this achiness, which is not explainable. And that's why it's very important to correct it. Even if you don't have symptoms, the reason it needs to be corrected, it's an important hormone. It's a very important vitamin. Your muscles and bone need it. And we have so much evidence and data that most of our cells will need it. Immunological functions depend on it. And there are many neurological conditions where neurologists actually recommend higher doses of vitamin D to cope with that particular neurological indications. Now, I am not your personal medical doctor, neither your endocrinologist. So this is not personal medical advice that I'm sharing, but also giving you the right information and knowledge so that you can discuss it with your clinician if you've discovered that your vitamin D is low or has been consistently low in your annual labs or in your blood work. So, to make things simple for you, think about a level of 25 hydroxy D between 40 to 60 nanograms per milliliter. And that's pretty ideal to stay at. It's a safe range where even if you have seasonal variations, you will not dip down to very low levels. And at the same time, you're in a safe zone where you're not creeping into the toxic levels because, yes, if we have vitamin D deficiency, we also have a medical diagnosis of vitamin D toxicity as an endocrinologist. Is one of the quite common conditions that I'll see, especially in this era where we have plethora of supplements being sold and multiple ingredients and multiple supplements having vitamin D in bits and pieces here and there, and that leads to excess amount of vitamin D intake. So always look at your supplements. And a good range, a good goal would be 40 to 60 if you're starting with as a goal from deficient to sufficient levels. Okay. Now, we have adequate studies also showing that 40 to 60 levels of 25 hydroxy vitamin D is also quite optimal for your bone health, especially in my patients with osteopenia and osteoporosis. I would have that discussion about the target for a 25 hydroxy vitamin D level. Now, guess where the most of the confusion lives when you're getting treated for vitamin D? Now, if you're discussing it with your clinician, you're severely deficient, that is very low levels, less than 15, then commonly clinicians will prescribe 50,000 IUs of D2, which is a prescription form, orgocalciferol to you, and they'll advise you to take one capsule once a week. Continue it for 12 weeks or sometimes 15 weeks, so a span of 3 to 4 months. But what after that? You check your levels. I'm sure the levels most of the times are pretty robust and solid, and you get basically a cure that, oh, your vitamin D was low, now you've corrected it, and now good to go. But that's where the mistake happens. Because in another 3 months, in another 6 months, your levels are going to dip down again if you're not on the maintenance dose of vitamin D supplement, which is most commonly D3. I have 2 bottles here. These are available on Amazon. This is not sponsored. This is one of the oldest supplements that we've had. I've been practicing medicine for a long time, since 20 years. But one of the brands is Biotech, but there are several other brands. You would not go wrong with most of them. Just make sure you're checking it for third-party tested or NSF certified or the ingredients and the components of it. But the reason I'm having you look at these bottles is on my left-hand side, I have D3, 5, which is 5,000, and then I have D3, which is 50,000 IUs. They both are over-the-counter, does not need a prescription. If you are now going to go on a maintenance dose, right? So we've completed the 3 or 4 month course of 50,000, say your clinician gave it to you, and you're going to start something on maintenance. If you're not going to start, talk to your clinician that what about my maintenance vitamin D dose? What should I continue now? Because you want to prevent vitamin D deficiency lifelong, right? So in those scenarios, our guidelines recommend anything between 800 international units to 2,000 international units, depending on your personal needs, depending on your sun exposure, depending on how you absorb, your skin color, and other medical conditions that you have. In many of my patients, this is what I do in my clinical practice, is I'll suggest them to just buy 5,000 IUs and take it on Friday, Saturday, Sunday, which gives them 15,000 for the week, or just take one capsule twice a week, which gives them 10,000 international units a week. Now, you can also take 2,000 IUs every day, and for 7 days, that would be 14,000 international units. Or you can just take 1,000 IUs every day, that would be 7,000 international units if your levels are quite optimized and you need a lower replacement or maintenance dose. So this is where personalization occurs, and this is where you want to be very aware as to what is your need and what doses are appropriate for you, not taking you towards toxicity. Based on our guidelines, it's usually recommended that avoid taking more than 4,000 international units once a day. Again, as I talked to you about in my earlier discussion, that certain neurologists, especially for conditions like multiple sclerosis, we'll discuss with the patient in regards to taking a higher vitamin D dose on a daily basis because it's targeting a specific health goal. Again, that's a very personalized decision making with your physician. Now, another practical trick that I'll give you and I share with many of my patients is about this specific D3, which is 50,000. There are other brands too, but if you're buying D3 50,000 over the counter and not taking the prescription form of D2, these are multiple, right? It's going to be 50,000. There are 100 capsules. Some bottles may have 50 capsules. So I would not take one capsule of 50,000 once a week, every week for ongoing basis for a year or longer because the risk of having vitamin D toxicity is very high, and vitamin D toxicity can lead to hypercalcemia, meaning excess calcium levels in the blood, and that could have pretty dramatic negative impacts on your heart, leading to arrhythmias and other problems. So, if you're buying this over the counter, which is 50,000 D3, I would also do this something similar. Talk to your doctor and look at a specific way of how to do it. Maybe consider one capsule once a week for 12 weeks, just the way it would have been prescribed in the form of orgocalciferol or D2, and then back off. Maybe you may need this 50,000 once a month, or you may need it once or twice a month. Have a conversation with your physician. Make sure in 3 to 4 months you're getting your levels checked to see what the rise has been. It also gives us an idea of how your gut absorption is for that specific vitamin D and what adjustments need to be made. Okay, so now you know there is D2, there is D3. D2 is prescription, D3 is over the counter, but there are multiple doses. But at least get an idea of what the weekly maintenance dose would be. You can completely eliminate the use of 50,000, be it D2 and D3, and just start with a daily supplement when you're trying to treat vitamin D deficiency. So individuals may need between 2,000 to 4,000 IUs every day consistently, and that might also be beneficial instead of taking 50,000 IUs. But don't just assume that once it's low, it's treated forever. You need some form or the other of a vitamin D supplement to make sure that it's not dropping, especially during seasonal changes. Winters, we are wearing layers, we have some less sun exposure, and that might also impact and cause the vitamin D levels to go. And summer arrives, by the time you're getting your labs done, you're coming out of winter, levels are low, and then again they rise. Our goal is to maintain more consistent levels so that your bones, your muscles, your other cells are getting adequate vitamin D consistently during all the seasons, 365 days. Now, if you wanted to go deeper on bone health, osteoporosis, metabolic health, GLP-1 receptor agonists, weight loss, diabetes, insulin resistance, or even statins, cardiac health, longevity, tune into my podcast, Hormones and Hope, where you can watch it on YouTube or listen on Apple and Spotify. The conversations, the discussions that I'm having with other physician experts throughout the country and even some internationally, so that you get guidance on appropriate evidence-based science. For more resources, you can always visit my website. It's unifiedendocrinecare.com. I would love to see you on Instagram at Chhaya Makhija MD. And if you've loved this episode, if you've liked this episode, share it with your friend, your colleague, or even your near and dear ones if they are dealing with vitamin D deficiency or low vitamin D. I will see you next time.